important.
Good evening. Good evening, one and all. Thank you so much for coming in big numbers again. 9:30 p.m. Indian Standard Time. We have almost more than 100 people in Zoom and a lot of people in YouTube too. So thank you. Thank you so much for coming in. Welcome to the free lockdown webinar series by Online Dentistry. Give us a couple of minutes more. Let's enter everybody into the room. Give us a couple of minutes more. We will start the session. The speaker is already online. All are ready. We will start the session pretty soon. Give us 2 more minutes. Okay. We have our regular listeners, Dr. Nayan Sri, full time, ever smiling. So nice to see you in video, Dr. Nayan Sri. Sahel Abdullah, I've been watching you for the last maybe 3 or 4 webinars, I would say. So happy to see you. Welcome, welcome. And Niranjana, pretty long time since I met you. Niranjana, come in video, yeah, please. Let me see you. So nice to see familiar faces, all big time pediatric dentists we are talking about. Niranjana is a pediatric dentist with heavy practice going on. Yeah, please come online, come on video, please. Others, if you don't mind, please switch on your video, which I always tell during my lectures. But I'm assuming that Dr. Sunil Babu, today's speaker, is also very interested to see some faces. Because from a speaker's perspective, if you don't see faces, oh my God, it's so... Hey, Dr. Muthuraman, sir. Sir, thank you so much, sir. Thank you so much. Sir, I'm actually going through what you went through around a month before. My staff in clinic COVID positive from yesterday, so I'm quarantined. I'm at this point of time quarantined, room quarantine, and my staff, myself, all the staff went for test today, expecting the results tomorrow morning. So let's see what's the result, sir. I remember what you said 1 month before when you went through the same thing, sir. I really appreciate that. Then who all are there? I can see some senior people here, but the name is Zoom user. Dr. Nasser, yeah, we have familiar faces here. Thank you so much for coming in big numbers again. Dr. Niranjana has come in video. Thank you so much, Dr. Niranjana, for coming in video. Dr. Jacob from Abu Dhabi is here. Okay, great. Nizar from Saudi Arabia. See, we have people from so many countries joining in tonight for this program. All right, this is 9:35. Let me start. Welcome to Online Dentistry, a firm started in 2008 with the motto, redefining dental education. We actually redefine dental education. We actually make sure that whatever we say today can be applied tomorrow in your clinic. That's online dentistry. Myself, Dr. Binu Abraham, orthodontist practicing in Kochi, and my partner, Dr. Joby Peter, pediatric dentist, professor and head, Department of Pediatric Dentistry, Malabar Dental College. My consultant pediatric dentist for the last 12 years. We together started this firm called as Online Dentistry. We started in Alua, Kerala, but we have centers all around India at this point of time. More than 10 centers all around India. We conducted courses all around India. Myself and Dr. Joby traveled all around India in car, plane, train, you name it, we traveled. We are missing it now actually, because all the programs at this point of time are stopped due to the pandemic. Let's hope, let's pray that we get over the situation at the earliest. It started off with one person from Italy having corona. Things have changed. It's like my staff along with me for the last 15 years is COVID positive yesterday night. And my clinic is sealed yesterday night by the health department. And I am asked to quarantine from yesterday night onwards. So I am quarantined. I did my PCR today morning, expecting my results late tonight or tomorrow morning. So you know what? It's all there. It's all there. It's all how you look at it. It's how you manage it. Thanks to this dedicated group of dentists and being with us all around these 8-9 months, every other day with free webinar, paid webinar. There are so many people who supported us. Presently, we have 2 types of online programs going on. 1 hour free webinar. That's what's happening tonight now. 1 hour free webinar with certificate of participation, of course. And then we have paid webinars, 3 to 7 hour big paid webinars also going on. So coming up programs, free webinars. We have Dr. Sharath Ashwakan talking about the psychology of dental patient management. Amazing topic you should listen to. Sir is one of the most sought after speakers in India at this point of time when it comes to psychology, psychiatry of managing kids as well as adults. Adult psychology is even more important and complicated, let me tell you. Dr. Joby is going to talk about Dr. Georgia Kotur is going to talk about endodontics. Dr. Georgia Kotur is one of the famous speakers in South India at this point of time, with microscopic endo programs going on in his clinic. He is good in what he is doing. Listen to him. Free webinars, 1 hour with a certificate. Do not miss it. Painless dentistry in gel dentistry, Dr. Srinivas Naimani. Dr. Srinivas Naimani from Hyderabad is such a famous personality in India. Any ISPPD conference, India Association of Pediatric Dentistry, he is there as a pre-conference keynote speaker, president of ISPPD. I mean, his level is different, and he has agreed to come into online dentistry platform to talk about painless dentistry for general dentists. Do not miss that also. Myself coming out with the topic next week on 2x4, that is sectional orthodontics. You know, if you're fed up with all that Z springs and finger springs and all that, we have a sectional ortho 2x2, 2x4 orthodontics coming up. Please follow us in learn.onlinedentistry.in. You will get all the details. Paid webinars tomorrow. Big program. 170 odd people registered already. Big program starting tomorrow. It's all closed and sealed. A lot of discussions going on in the groups already. See you all tomorrow. I'm sure many people who are there tomorrow are here today. See you all tomorrow for that huge session on cephalometrics, completely decoded for private practitioners. And then we have a TMD conference coming up, 2021-22 November, conference on TMD. November 22nd, Sunday, note it down, guys. That one full day by Dr. Deepak is going to be worth it. It's going to be worth it for those who register, because he's such a practical person. He's the person who is involved in training general dentists on how to approach TMD with an articulating paper and some acrylic, guys. It's that simple, that practical. Do not miss this 2021-22 November on TMD. Then myself coming with clear aligners. Anybody want to incorporate clear aligners into your practice? Do not miss this topic on clear aligner. One full day, I would call it. Hours and hours on complete practice management, complete case diagnosis, how to go about with a clear aligner case covered on one full Sunday, that is 29th of November on clear aligner. So these are the paid programs. That's it. Those who are still not in our groups, please note down this WhatsApp number. Please WhatsApp us personally into these numbers. We'll add to a WhatsApp group so that you get all the updates. Those who are watching us through YouTube tonight, please subscribe. Click on the bell, the notification thing, so you can get all the notifications. That's it, guys. Thank you, and over to Dr. Jobby to introduce the speaker for tonight. Jobby, over to you.
Thank you, Bino. Thank you, Dr. Bino. Thank you so much for the elaborate introduction. Good evening, all. I hope everyone is safe and sound in your respective place. So, Doctor, my buddy, my friend, Dr. Bino, if you are going, even I have to go for quarantine, because we have met 3 days back in his clinic. We had a consultation. We had some videos for our upcoming course. So, if you are going, I am going. I also have to go for a home quarantine. So, I'm waiting for your result. You tell me your result is plus or negative. I will plan it. I am prepared for that also. Thank you so much. So today's topic, the speaker to talk about it, Dr. Sunil Babu Kota. He is now in Saudi Arabia. Let me tell you the best thing I liked about him is we are being in touch after the lockdown through this WhatsApp group. Only I have come in contact, or he has attended one of our courses, and through that we came into contact, and this lockdown came, I started knowing him closer. One of the things that he wants is, Dr. Joby, do you have an evidence? Do you have an article to refer? Do you have some studies happening, is it can be applied in our practice or not. And he is very evidence-based, authenticated and professional way only he will approach. That's the one thing that struck me, that liked me. Yes, we should not do unethical practice. We should do ethical and evidence-based practice. So with this is the way like I like introduced to him. The limited time period which I have known him, I really understood that we should have a support to practice to do the best for our patients. So he is currently working as an assistant professor and a program director for the master's programs in pediatric dentistry in Riyadh Al University, Riyadh, Kingdom of Saudi Arabia. And he's working hard on to bring one of the best chapters, you can name it, general dentist, pediatric dentist. You should look out for the chapter he's working on it, the dedication. He's already done that. He's editing that chapter in one of the most famous textbook in India on pediatric dentistry, and he's writing a chapter on Hall's techniques in a textbook titled Pediatric Dentist Principles and Practice. Third edition is going to come out, and it is by none other than Dr. Muthu, one of the famous pediatric dentists in India. You search his name, you can see his studies, his research, and he is a part of that textbook. And one chapter he is doing it on that. So that's great. Hats off to you, sir. He is doing into that, and his famous research area is minimal invasive dentistry. That is an amazing upcoming topic in dentistry. Many of us doesn't know what really minimal invasive dentistry can do, and he is a researcher in that, and his main interest is on minimal invasive dentistry, MID. This is applicable not to pediatric dentistry, not to teenage dentistry, even into adult and geriatric dentistry. Minimal invasive dentistry is the new scope or new, and he's doing research on that. Thank you so much, Sunil sir, accepting our invitation, coming all the way, spending your time. I know that you are a very tough day, Saturday, in his university, in his hospital and college is stuffed with cases, and he's very busy there. But he agreed and working without dinner is addressing you all, because he is too much interested in addressing the general dentist and our group. Thank you so much, sir. Over to you.
Thank you very much, Dr. Javi sir and Dr. Binu and Dr. Joe and the whole online dentistry. First of all, I like the way you people are so committed, and you have been doing this webinars so regularly, and I've been attending your webinar since March. I'm like, this is like it has been so many months and still going so consistently. It's very nice, and thank you for giving this opportunity to present here. And by the way, doctors, this is my first webinar I'm doing it, and I thank you for the online dentistry for giving this opportunity. So I'll just share my screen. Yeah, sir, everyone can see. You can see, sir.
Yes, sir. Yes, sir. You go ahead, sir.
Okay, that's great. That's great. Good evening, everyone. Good evening from Saudi Arabia. I don't know which part of the world you people are. Okay, I hope you are having a good time. I hope all of you and your family are safe and healthy. So let's start our presentation. So before going into detail about my presentation, I just want to tell about the discussion which happened to us between me and between Joby sir and myself. Like I was telling that I will take the topic of Hall's technique in general, but he told that the most of the audience here are the private dentists or the undergrads and even the pediatric dentists. So it is like to make it common, to make it easy, and to make it understand to people. So to every one of them. So we made a topic like management of multi-surface restorations. So here, basically, I'll be talking about, before going into myself, as Dr. Joby told, this is Dr. Sunil Babu. Okay, and I'm the assistant professor, program director for the master's program in Saudi Arabia. So I'm here in Saudi since 8 years. Like, it's my second home, to be frank. Okay, this is the place where, like, they treated me very well, and I am very comfortable, me and my family. So this is about myself. Okay, so this is where my university, we have 4 campuses. This is where I work. It's one of the best private university in Saudi Arabia, and they provide all the, like, we have dentistry, pharmacy, nursing, and for both males and females. So it's a wonderful institute to work here. Okay, so coming to my topic, before going into that, I just want to have a disclaimer regarding this. I'm still a student. So those who are the senior faculty, my teachers and my friends, okay, so excuse me if I do any mistake or anything, kindly correct me. Okay, I'm always a learner. Even the students, if anyone want to correct me, always welcome. So these are the contents which I am going to speak out today. It's like the basic things. It's about why more care is seen in the primary teeth compared to that of the permanent. Okay, and what are the different restorative materials you use in your clinical practice. And I'll be mostly talking about, because everyone, I'm not going to take a lecture like what are the advantages, disadvantages, indications, contraindications. I'll be talking just about uh, the difficulties what you have in the regular restorative materials used in pediatric dentistry, and coming to the stainless steel crowns, which makes the like, this is actually a boon for a pediatric dentist, like those who are working, the pediatric dentists or any dentists who are working on stainless steel crowns. And I'll be talking about the Hall's technique, how this has transformed the simple stainless steel crowns into a different technique, very easy technique. To be frank, everyone, any practitioner can work on this particular technique. So this is about, so coming to the teeth, when we are talking about the primary teeth, for example, if anyone asks, where do you find the teeth, like the dental caries, more in primary or the permanent? Everyone says that it's primary. Why? Because everyone want to blame on the children that they eat chocolates, they eat cakes or whatever and whatnot. Okay, but according to me, yes, I don't blame the children, because I love chocolates. So I'm like, I can't blame the children that they are having chocolates. Okay, but it's the care what we take is rather more important, what I feel. Okay, but and not only about the habits, we always blame on the children or the parents also, that you people are not taking care and everything. But rather than that, there are other issues also regarding the histology. If you know the basic histology of the primary teeth compared to the permanent teeth, these are certain points. Again, I'm telling you, I'm not going in to elaborate everything. I'm just going to enumerate what are the points related to why dental caries is more in the primary teeth, other than the habits what they have. Okay, coming, these are the things like you have regarding the enamel prisms, regarding the neonatal line, postnatal enamel. These, like, the neonatal line, you can see the neonatal line as you go back to your undergrad oral histology classes. If you go back there, you remember the neonatal line. The neonatal line is a hypomineralized area which actually demarcates between the formed enamel and the dentine before and after birth. So this is the area, again, makes the tooth weak in the primary teeth in particular. As you all know, that the neonatal line is present only in the primary teeth, except with the exception of first primary molars. So the neonatal line plays a role also because of the hypomineralized nature. being more prone to caries. And then comes the enamel prisms also. If you see the enamel prisms in the postnatal enamel, basically, okay. So in that particular area, because of the porosity and everything compared to the permanent teeth, it is comparatively more. So that's also one of the reasons why we see more of the caries in the primary teeth. And the next thing is the postnatal enamel. Again, the same thing what I was speaking about, because of the prisms. Okay, so even the porosity of the postnatal enamel, as what I spoke before, these are all, I'm telling, I'm not going in detail about this particular area, but the thing is, these are some of the reasons why there could be more caries in the primary teeth, unlike the permanent teeth. So these are postnatal enamel. And now coming to the caries. Okay, as you know, like, I think most of the practitioners are concerned about this particular area. I get the patients with caries. Now how I need to treat. Okay, so these are all the different restorative materials, nothing new for you people. Everyone knew these, everyone are using these materials. And I'm not going again in detail about different materials. Okay, but in basic, I'll be talking more about the disadvantages or the difficulties what you people face in your clinical practice. So I'm not going to talk about indications, when to use, when not to use, and so. But if you fill or if you use these basic materials in the multi-surface area, multi-surface carious lesions and primary teeth, what are the difficulties you faced? And you can also understand whenever whatever I tell the experiences or whatever I speak about the disadvantages, you might have also experienced with your patients. Coming to the, you have amalgam, composite, glass ionomer, cement. These are the common. I'm not going into subdivision, okay, like resin modified, glass ionomer, compomer, or so. But I'm just telling the basic. These are the basic area. These are the basic materials you will be using for any restorations, including the multi-surface restorations. And once again, the boon, our full coverage restorations. Those who are using it know the importance of the stainless steel crowns. Okay, I'll be going one by one about these particular area. For example, amalgam, the disadvantage for the amalgam, as you know, as the black classification states, okay, wide area of prevention, cavity preparation. Okay, you will be destroying the extension for prevention, and you are destroying the healthy tooth structure. You all know from year one of your BDS. Okay, and then coming to the fracture of amalgam restorations. And nowadays it is the aesthetics which is more common, like the tooth becomes black over a period of time. Okay, so this is one of the most popular area the world speaks about amalgam. To be frank, personally speaking, I really love to use amalgam. Maybe most of the young dentists don't agree with this, but in terms of longevity, as a practitioner, end of the day, my patient should not come to my clinic once I have filled the tooth. And I feel this is one material that I have seen a lot of patients who never come to the dentist again after filled with amalgam. Those who have like the young dentists who have not experienced with this. Okay, but still, end of the day, these are all the disadvantages, the mercury poisoning and everything. Okay, then coming to the composite resin. Composite resin, wonderful material, no doubt about it. It is ruling the world right now. Okay, but still it has its own disadvantages, particularly using in children. Like the technique sensitive, you know, like a 4-year child comes to you, 5-year child comes to you, it's really tough who are working on child patients to keep a rubber dam using etching, bonding, and being technique sensitive. And these are the disadvantages. And as you know, it is one of the expensive material you use. And the most of all, the most difficult thing to handle a child to do a composite resin is the patient cooperation. That is the main reason. Most of the pediatric dentists, as far as I know, okay, most of them love to go with glass ionomer or resin modified glass ionomer. Okay, I hope most of you, like, everyone will agree, those who are working on the children, that this material is a real boon for us to work on the child patients. Okay, but still they have their own disadvantages, like the fracture, the very chances of fracture, the wear resistance, but still it's modified the by resin modified glass ionomer cements.
Sunil sir.
You can hear me, sir?
Sir, your voice was stuck in between. Can you start with the GIC again?
Yeah, yes, I will do that. I will do that. Yes. Can you see my screen, Dr.
Yes.
Jabi? Okay, fine.
Yes, sir. Can you go one more slide back? From there, can you start again?
Okay, fine. Yeah.
Yeah,
So,
from this.
again, I repeat, uh, those who have missed it. Okay, glass ionomer cement, as I told, it's a big boon to pediatric dentists because of the nature of the material, because that's how it can overcome lot of difficulties what we face during use of composite resins. Okay, so that is one area we use glass ionomer, but still the glass ionomer has its own disadvantages. Okay, so the fracture of the material, the low wear resistance, and water sensitive till it's this is, as I told you, this is one area again we all face a problem, because when we do a restoration, the composite is wonderful. After doing a restoration, the patient can eat and can drink whatever he want, but not with the glass ionomer cement. So he has to wait for the initial set. That's a big challenge for the pediatric dentist to work on. And as you know, it is less aesthetic compared to that of the composite. Uh, and then coming the stainless steel crowns. As I told you before, it's a big boon for the pediatric dentist, as because it's like happy multi-surface restorations. It will happily cover all the multi-surface areas, and there is no problem for the pediatric dentist, and hardly any complaint come from the patient. And that's the reason, like as Dr. Muthu always says, like the statement given by him, you have Ferrari in cars, Harley Davidson in bikes, and stainless steel crowns in pediatric dentistry. I will definitely agree with the statement because it's very apt. Just imagine a pediatric dentist or the dentists who are working on the children. Just imagine that you are having a pediatric patients and not having stainless steel crowns in your clinical practice. If you start working on stainless steel crowns, trust me, after this presentation, you will definitely feel like, why not we are not using stainless steel crown all these years? Because basically that's one, at least back in India, nobody works, the undergrads at least, we were not taught. I don't know, like it depends on the university where you have done your dentistry, the course where you have done, but we hardly had any exposure with the pediatric patients, and that too with the stainless steel crowns. So as far as I feel now, once you finish this webinar, from tomorrow, trust me, you will definitely get the crowns and make the children happy. So this is what I then coming to this crowns. Okay, as I always was telling you these are all the disadvantages for all the different areas, the amalgam, composite, and the glass ionomers. I think people please don't confuse about why this blue and red and so. Okay, it is basically what are the blue areas are all the disadvantages of the respective materials have been overcome by the use of stainless steel crowns. Okay, so there is no chance of fracture of respiration. There is no chance of mercury poisoning. There is no technique sensitive. It's not technique sensitive, to be frank, to do a stainless steel crown. There's no need to use a rubber dam. No issue of fracture. No issue of water sensitive till it sets or whatever. So that's why I told that stainless steel crowns are really a boon to a pediatric dentist. So it overcomes almost 90% of the disadvantages what the regular restorative materials what we use for the multi-surface caries. Okay, so these are the things, but still, okay, I'll before going into the Hall's technique, I'll be talking about the conventional stainless steel crown preparation, what exactly you do it in a very brief way. And also I'll tell the disadvantages of this area and how the halls have come into picture. So this is what I've been telling you. These the ones which I've mentioned here in the conventional technique, you still have so many disadvantages. If you go back to the previous slide, the stainless steel crown has covered most of the disadvantages of all these materials. And you come back to the conventional technique, still you have so many disadvantages. And you'll be surprised to see the Hall's technique will overcome almost 99% of the disadvantages of even the conventional technique. So why we don't prefer to use now the Hall's technique? Like it is, there's no extensive preparation. The patient cooperation is good. No need of local anesthesia. I think that itself makes all the pediatric dentists, rather the practitioners, make so much happy that no giving local anesthesia for children. Why not? Okay, this is one thing you will be happy to listen to. And then there is no manipulation of the crowns, and it's not time consuming. It's hardly, on an average, as the research says, it goes not more than 3 to 4 minutes. You can fix the stainless steel crown and make the child happy. So this is the technique basically about the stainless steel crowns. As those who have well versed with it, please bear with me. Okay, the same. This is like you need to reduce 1 to 1.5 mm, and you need to do the proximal surface. For all this to do in this conventional preparation, we all have to give local anesthesia, and end of the day, we need to use the burrs. These are the two areas where most of the children hate it. And so because of this, the children really hate it. One of them is local anesthesia. They don't want the extensive preparation of the crowns. Then the patient cooperation because of using the burrs and local anesthesia. Then the manipulation of the crowns and the time consuming. So end of the day, if you are taking more time doing all these things, though it is the very advantage compared to that of the glass ionomer, the composite or amalgam restorations, end of the day, when you are giving local anesthesia and using a handpiece and so, that itself loses your patient confidence for almost 80%. So from this came what is called as Hall's technique. Okay, it's a wonderful technique. Okay, it's like we travel really less when we are doing in comparison to the conventional technique. So before going into this Hall's technique, I first want to thank Dr. Muthu and Dr. Shivakumar sir for giving me this opportunity to write a chapter on the Hall's technique in their third edition, which is going to be releasing maybe in the mid of 2021. So I'm very glad that they trusted me, and it's a pure coincidence, frankly speaking, when Dr. Muthu and Dr. Shivakumar sir spoke to me regarding this, and within a week or 10 days, I was speaking to Dr. Joby sir. Then I'm like, straight away, I'm like, why not the same topic? And I've asked him, anyone has taken the Hall's technique, and I have seen, I didn't find any. So I thought, why not? It's a very good technique, very good topic for the practitioners and also the pediatric dentists, the undergrads, or even the postgrads who are working on, okay, who are listening to my webinar. Okay, so coming to the technique, before going into the technique, I want to speak about the prophetic statement what Dr. G.V. Black has given. Though he is always into like extension for prevention, but still he had given this statement like G.V. Black, the day is surely going to come, and perhaps within the lifetime of you young men before me, when we will be engaged in practicing preventive rather than the reparative dentistry. The G.V. Black who came up with reparative dentistry, cutting the tooth extension for the prevention, had already had foreseen the things that the young will come with the preventive aspect, and here we are. So coming to the introduction and the historical perspective, as I told you before, this is one of the beautiful material, beautiful technique to use in the stainless steel crown. This is, I'll tell a small story how this happened actually. It's like a real thing how this happened to Dr. Norna Hall. Basically, she's a dentist from Scotland. She shifted her practice from Buki. By the way, the picture, I couldn't find her picture, but this is Prof. Ines. She's the one, you open Hall's technique, you will find her name next to that. Okay, 9 out of 10 publications will be under her name. So I could get her picture here. I couldn't get Dr. Norna Hall's this one, the picture. Now, about when she shifted her practice to Buki in Scotland, she found that most of the patients there are suffering, like they are very pure people, and they are suffering from the caries. I can say the multi-surface carious lesions. And she didn't know like what to do because she cannot charge the patient, and she is going on a community trip, and she want to do this. So she was just experimented, frankly speaking, experimented by doing this Hall's technique. I'll come back to the technique, what exactly is this, but she started doing this technique, and it was really wonderful that, and she didn't realize until 2000, okay, the year 2000, that she went to a retrospective study, which is actually a university. In the university, it is being published, but it's not into the PubMed area. So that is the reason that that particular results were not discussed anywhere in the literature. Okay, so she started giving without any modification of the crown. It happened by chance, and the patients are very happy, no complaints, nothing. So it ended up giving her name as Hall's technique, usually performed with the same stainless steel crown what we use in the patient, was first introduced into the literature in 2006 by Innes et al. Okay, so this is how it started, the Hall's technique. It started, just imagine, 2006, it's not even 2 decades. 1.5 decade it has come to this world, and extensive research has been done. There is lot of evidences. I'll be showing in the forthcoming slides. There's extensive research which is being carried out and very successful, very successful. So I'll be talking about it in detail right now. Okay, before going into the technique, I'll just speak about the basic indications when you can do this technique. Okay, again, I please listen the practitioners who are doing, and the pediatric dentists, particularly the postgraduates. Okay, those who are listening and those who are not preferred. And trust me, most of the faculty here, I know most of the people, they don't agree with Hall's technique. But with the evidence I'm telling you, I have used, like, I have done many cases on Hall's technique. And trust me, I was so happy, and the patients are happy, the parents are happy. What more we want? So coming to the indications, when do you do this technique? It is one of the area where all the practitioners will agree. When they don't want needle and they don't want this, if these things are avoided, if these things are the area where the child is against, like they don't like injection. Almost 9 out of 10 children don't like. Okay, in these conditions, you can use Hall's technique. I think this slide itself will make most of the practitioners happy. Then coming to the moderately advanced occlusal lesions, I'm very sorry for the pictures. Some of them are not clear. Please excuse me for that. And then coming to the proximal lesions, as you all know, okay, as you all know, these proximal lesions are very common, unlike the permanent teeth. The proximal lesions are very common in the deciduous teeth because of the broad contact area and so on. Okay, and these conditions, it's very easy, and you can see with the arrow here, the only thing you need to see is any radio opaque area which is there between the caries and the pulp. If this is there and you have a proximal surface caries, trust me, this is one of the best material. No need to give anesthesia and do class 2 restorations, or you do class 2 restorations even without anesthesia. If you are giving, trust me, the retention of these restorations, whatever you do, either composite or the or the glass ionomer cement, it's very difficult to manage them. So in these conditions, you will be doing this Hall's technique. And in the hypoplastic molars also, you can give the Hall's technique, because as you all know, the hypoplastic molars, you cannot now cut the tooth, prepare the tooth. It's already hypomineralized. So you cannot afford to destroy the tooth more. So in these conditions, you can use this Hall's technique. And by the way, there are many other indications also, but as I was told to, because most of the audience here will be the practitioners, I don't want to talk what is there, everything in the textbook. I'm talking only the clinical areas. These are the areas where you commonly face in your regular practice. So coming to the contraindications, this is one thing, no, big no for any condition with irreversible pulpitis. And no clear band of dentine covering the pulp in a radiograph. Okay. Then coming to the mutilated molars, again, very sorry for the picture. And this is one of the most important thing. A 2-year, 3-year child comes to you. The basic area, the basic thing here in this Hall's technique is after fixing the crown, the child needs to bite the teeth for some time. So this is the only critical area. In this particular area, if a child is not able to bite the teeth, you cannot do this, because you need to have the pressure on the tooth so that it will settle nicely into the occlusion. So these are some of the indications and contraindications. Again, I say there are certain areas which I didn't speak about. So kindly go into the literature. I'll be even showing the literature like evidence-based in the forthcoming slides. So coming back to what exactly is the concept? Now I think you people will be like, okay, this fellow is speaking about indications, contraindications, no anesthesia and everything, like what exactly you want to say. So the basic idea here is the concept behind the technique. What exactly is the concept behind this technique? It is like, you can see the picture here. As I told you, no preparation of the tooth, no giving anesthesia. You can see you will just keep the crown on the carious tooth surface. I know most of the practitioners or even the pediatric dentists, some of them don't agree. As I told before, they don't agree with this technique. Okay, but again, there is a lot of evidence which I'm going to speak about. And this is like carious molars. You need to cement it on the carious surface. So just imagine my contemporaries who are there listening to the webinar. Just imagine you say that you will prepare a crown on the, you place the crown on the carious surface. Okay, your professors would have been like this, your expression, like, how can you leave the caries? That is one thing we always face during our undergrad program. It is there is a black area, you first remove that caries, then I will come and see. So we have been calling our dentists like previously, like, doctor, is it enough? No, you will remove the caries. That is the concept we have been growing up. about. And as I told you, the research is growing so much that rather a day, the previously it was like complete removal of the caries. Now it came to the area where no removal of the caries. And there are many comparative studies also regarding this. You don't believe, there is no statistical significance that however you do only the preventive technique or you do just without removing the caries or partial removal of the caries and restoring with any restoration, still there is no significant variation in the patient's pain or discomfort. So that is how we came into a research right now. Okay, so when how do you justify this? Okay, how can you justify? Come on, yeah, you are removing the caries, and I mean you are not removing the caries. The caries will grow, enter into the pulp. How can you do this? If you go back here, okay, if you see this, like as you all know, we need to have all these areas for the dental caries to happen: the carious tooth surface, the carbohydrates, microorganisms, and of course the time. So these all areas combine to form the caries. You all know this, you might have read in your undergrad. But here what you are doing, basically you can see a black round thing around the crown or the carious tooth surface, which is not allowing your food or anything to go and reach the tooth. And there is no microorganisms reaching the tooth. So what happens in the remaining organisms? They will obviously, they will die. There is no food, khalas, they will die, right? So this is the main idea, the main concept for the Hall's technique. Okay, and the progression of caries is stopped over a period of time. The microorganisms which are inside will die because of the lack of nourishment. So this is the basic concept of this. This is the justification what the Hall's technique has given. And coming to the clinical steps, I think I'll be telling, just check into the clinical steps. You see this, this is how the basic area, whenever you are doing a Hall's technique, if the proximal surface is tightly contact, please use this elastics just to create a space between the teeth. We want the stainless steel crown to just enter inside. That's it. Okay, so this is the first step: assess the contacts and use the separator. And I'll be speaking about the modifications, like doctor, if there are no contacts, primary teeth doesn't have contacts. So I will talk about it. If there are no contacts, it's well and good for us. So then coming to trying the crown, okay, the basic way how to try the crown is you have to keep the crown here, not completely inside. It has to go half, so that when you apply pressure, it has to spring back. It means that it is extending both mesially and distally between the contacts. It should able to spring back. So that gives an indication that this crown is correctly going to fit. And in the pictures, first and second pictures, what I've shown, it is like for the safety, because the stainless steel crowns with the saliva, it may slip into the throat, okay, into inside. That's the reason these are the protective areas we need to consider. Then simple. Next thing, fill the crown with the glass ionomer cement and keep on it. This is the initial stage of seating, where all the extra, the only thing here is, previously when we are doing the crowns for even the permanent teeth, when you are doing, we always tell that just a layer of the cement should be there. But here it's like you half fill or 2/3 fill the with the glass ionomer cement and just use it. And you just stabilize it for a while. The only disadvantage in this particular area is patient may slightly feel a discomfort. Okay, so then this is the first stage of seating. Then this is the second stage of seating, and remove the extra whatever glass ionomer cement which is there. And here ends the technique. It's very simple. Basically, it's a really very simple technique. I'll be showing this. See this. These are the 4 steps you need to do, and it's over. Just imagine it takes hardly 5 to 6 minutes. By the time patient comes to uncooperative, you'll fix the crown. He cannot remove the crown. So you will keep it maybe after 10-15 minutes. Once he removes the cotton, all his discomfort is lost. You believe or not, you try practicing this technique. Trust me, the children will be loving coming to your clinical practice. So I'll be showing like some of the videos what I made it. I'm very sorry if they are not clear enough. Okay, but I tried my best to do this to make the videos. Uh, just give me some time. I think I need to. Dr. Joby, just give me 2 minutes. I will.
Go ahead, Sunil. Go ahead. No problem.
Okay. I hope I'm not taking more time. I don't know. I'm not finding this videos. Can you see my slide video by any chance?
No, sir. I think you have to stop the share and then you check it, sir.
Okay, I should leave it and come back. Huh?
Yes.
Okay, fine. Sorry for that.
Dr. Sunil, are you there?
I still can't see the videos. I'm very sorry for this. I don't know what happened, sir.
Sir, you have to first share it. Can you first share your screen?
Okay, fine.
Yeah. First share your screen. Open up your Windows folder and then you will be able to do that. Yes. Yeah.
Yeah, I couldn't find my videos in the.
Have you kept the videos in the desktop?
They are there on the. Yes, they are in my download section.
Yeah, just go to that downloads, open that.
Okay.
Yeah, patient 1.
Yeah. Is it
Yes,
seen now?
yes, we can see, sir. We can see. Sir, you have stopped it?
Okay. Okay. That's great. Okay.
Yes,
Thank
sir.
you
Sir,
so much.
you are lost the connection,
I'm
sir.
very sorry for this issue. I
No issue,
couldn't.
sir. No issue, sir. No issue, sir. It's a great presentation going on, sir. Can you please? You have lost the connection, I think. All of you, please kindly understand. He's from Saudi. He is having a connection problem. So please, once he comes, yes, come, yes, come, yes, come. Sir, are you audible now?
Yes, I'm audible. Can
Yeah,
you
sir.
hear me, sir?
You can start, sir. Patient 1, you can start, sir. Now it
Yeah.
is very fine, sir.
Okay, fine. That's great. Okay, coming to this patient one, I'm very sorry if I have missed certain steps because as I told you, the whatever we speak in the book, you may not get the patients exactly what you need. Like for example, this particular case, it is like we didn't need, to be frank, to use the separator. So if you see this technique here, it's very easy. There is a proximal caries with the patient. I have just selected the crowns. Okay, this is the area you need to stop. You need to see, okay, is it going between the is it springing it back? Is it covering both mesial and distal surfaces? Okay, and just check it, fill it with the cement. As I told you, just press it the initial set. Sorry for the quality of videos. Kindly excuse. That's it. Here ends the technique for the stainless steel crown for this particular area. So next is I will show one more video, like yeah. Can you see this technique?
Yes, sir.
Can you
Yes, sir.
see
We
that?
can see
Yeah.
that. We
Okay,
can see
that's
that.
great. Okay, it's like I'll just go fast. You can see that is just class 2 caries. I just selected the crown and I fixed it. And yeah, I'll be talking about, you might be thinking about why this looks like there is no occlusion or so. That is one area most of them don't agree with, like not to do a Hall's technique. And I'll be doing in the same patient in a different site. This patient I have done for both the sites actually. Yeah, we have done on the right side also. So here ends the yeah. I hope you have seen, you have understood the technique what I've been using here. I really hope that it's clear, because I'm very sorry for the videos, but thank you so much. This is my intern who works with me in my clinics, Dr. Vastain. And I should be thankful to my son also, my elder son, who made these videos. He edited and I sat with him and troubled him. Okay, thanks to both of them. So coming to these are some of the modifications. Okay, as I told you in a previous slides, I have been showing the conventional technique for the Hall's technique, but there are some modifications which I've been speaking about, like because of the spacing between the teeth. Do you really keep the separators to separate the teeth? Not needed. Okay, so these are some of the sorry. Yeah, these are some of the modifications. For example, in this condition, in these two conditions, you can actually fill a temporary restoration and you can separate the tooth. Temporary, by the way, it takes at least around 3 to 5 days for the teeth to separate. Okay, so this is one of the modification you can use by filling the temporary and keeping the separators. Or if you want to skip your appointment, like why not do it in one appointment? Why to call the patient again? In such a case, you can actually use the burr just to break the contact at that particular contact. Okay, where for which I don't think so any anesthesia is required. In such a case, you can do within the same appointment. Okay, or the smart Hall technique, as you all know. Okay, the atraumatic restorative treatment. If you remember your undergrad in the program what you have read, it is atraumatic restorative treatment. You are not using any handpiece, you are not using any burrs, sorry, you are not using any local anesthesia, you are just removing the caries with the hand instrument. You remove with the hand instrument and keep SDF, silver diamond fluoride. And the smart Hall, this is called as Hall's technique, sorry, the smart technique, for which a crown is placed above it. It is called as smart Hall. Okay, so this is one of the technique, this is one of the modification you can use in the this particular Hall, or any area. Like if there is a proximal loss of it, you can just take the contouring plier and just bend the stainless steel crown. It doesn't matter. It doesn't matter. End of the day, you have to cover the whole caries, preventing it to get it exposed to the carbohydrates or whatever you eat and the microorganisms. Your target is to keeping away the caries which is there inside the tooth to the carbohydrates and the microorganisms. So these are some of the modifications you can do it for doing a Hall's technique. So coming to the advantages, as by this time, I think you people have understood what exactly are the advantages. Okay, so I'm not going to go in detail one by one, but you can see it's a non-surgical, non-invasive procedure. It maintains the pulp vitality and proper marginal seal, okay, than the conventional restoration. And the good thing about this, we are using glass ionomer cement, so it helps in the remineralization. The treatment time is less. As I have told you, it is not more than 5 minutes. You can see, you had seen this, the videos, what I have shown. Okay, even some things I might have edited or some time which I have taken. Not more than 3 to 4 minutes for placing this crown in the using this Hall's technique. It's very cost effective compared to that of the conventional restorations, because the patients will be coming again and again for the refills, and the patient will be losing money for the every refill, and the problem is the patients lose the confidence in you. And trust me, you try this Hall's technique, the patients will be very happy. Rather, most of the dentists, the practitioners, tend to avoid working on the pediatric patients. Okay, you try this technique, just get 1 or 2 crowns and try in a couple of patients. You will see it's really wonderful to work on these patients. Okay, it avoids the iatrogenic damage to the proximal surface of the adjacent teeth, because when you are using the burr or so, you may cut the adjacent tooth surface. So these are some of the advantages what you have. And you know, even in the acceptance, this is one of the research which is done again by Evans and Innis. There are many other things, areas also in terms of acceptance by the child, parent, and the dentist. You can see here the red area, the Hall's technique, how people are so happy. The children are so happy. The parents are happy. The dentist is happy. You can ask me why the parents are not so happy. The reason is, I'll come back to that later. Okay. I hope like I'll be going fast regarding this. And then coming to the concerns and clarifications, like even the pediatric dentists who are here listening, not happy with what you are doing, the Hall's technique, not accepting this technique, or any of the practitioners who have in your mindset that without removing caries, why should I, how can I do this? If you are still not convinced, I'm going to show you the evidence how this is being carried out and how successful are these techniques. Okay, so those who are into academics, the postgraduates, if you still want any more number of articles related to this, please, you can always contact me. Leaving the caries, this is one of the main concern leading to progression of the caries, as I've already explained regarding this. Okay, so it's that shouldn't be an issue at this particular area. Then coming to the bite opening and the occlusal prematurity leading to TMJ problems and all these issues. To be frank, you see this, the temporomandibular dysfunction has no effect, like no persistent symptoms. Okay, more comprehensively might be useful for the future studies, this particular study. Okay, to be frank, it has to, there are many studies to be done. This is a recent article which has been published in January 2020. And this is one more article related to this, the 23 months study. They found out that there is no signs and symptoms. And the author here, again, the Innis, she speaks about this particular area, that even the orthodontist will be giving a bite planes and everything. Still, they don't have a problem. But for a stainless steel crown, using in a Hall's technique, within 1 week, maximum 1 week, and there are literature which shows like 1 week, 1 month, or even 6 months, the fit is finished and the patient doesn't have any complaints. I can tell you, like with my experience, what I have been working, the patient will have slight discomfort in the initial stages. Like once he goes home, after half an hour, once he removes the cotton, trust me, the child will be very happy regarding this. And the one more concern regarding this is, this affects the masseter muscle activity, because you are biting, like there is a high point. You always tell the composite, you have a slight high point, you'll be like, the patient will be having discomfort. But here, stainless steel crowns, it is such a wonderful material, wonderful restoration, that it will, it's very biocompatible. The gingiva will very much easily, happily accept this material. So they, based on this, they have the Hall's technique on electromyographic study also shows that, okay, it will be returned to normal maximum by 2 to 6 weeks. So it is not at all an issue using the Hall's technique. One more concern right now is exfoliating faster. This is one area with, this is one published article which says that it gives a logic in particular, particularly the adult, I mean, the teeth here, like irregular surfaces at the high point, prematurities. It causes resorption of the periodontal ligament and more chances for the exfoliation of the tooth. So this again had a study, and they have clearly told that there is no significant relationship with early exfoliation of the primary molar with this technique. And then the post-operative infections, but the decision of the covering of the restorations because of the caries, as I've already explained about the caries, it doesn't spread beyond. Okay, and this article has shown the research showing, again, one of the author is Anis here. You can see here in the research here, there are 25 minor failures in that only 2 crowns have been failed. Okay, and there are 10 major failures of all this comparison with the conventional technique, the regular restorative material and the Hall's technique. And they found out that only 1 failure out of 10 in comparison for the major failures. So with all these concerns, you can understand that it is really evidence based, and you can work on this technique. You just try 1 or 2 patients, you will love this technique. And this is one of the most important concern. Okay, like ethics about the concept. Okay, this is one of, again, the most important area. How can you close it with the without removing complete caries? But you know, according to this minimal intervention dentistry, the preservation of what remains is of utmost importance than the meticulous replacement of what it has been lost. Okay, so this is an area where it's not that we are going beyond ethics. Okay, we are following within the limitations of the ethics. And one of the most common area, the patients. Okay, how the parents will accept without. It's very nice, beautiful explanation given by Dr. Jean McLean. Okay, this is her slide. I copied and pasted her. This is like explain to the parent. Okay, what would happen if you put in a tank of cement? Put you in a tank of cement. Will you live or you will die? So just imagine, tell that the microorganisms inside packed with the cement, that to the fluoride releasing cement, and it will die. This is the area, this is how it really works. If I talk to the patient like this, if a patient argues with a half Google knowledge, this particular area, if you tell this statement, 9 out of 10 patients, the parents will agree with this. Okay, here ends the concerns and the clarifications for this area, and evidences showing success. There are many evidences. If you want the articles, any postgraduates or anyone, if you want any articles related to this, because I have been writing the chapter, I have enough, like it started from 2006 till January 2020. I had even every article, including the textbook articles. Okay, so if you need anything, I am very happy to share with you. And you can see the evidence on the right side column. Everything not less than 90% of success for the Hall's technique. So this is how the evidence says that Hall's technique is an effective treatment option for many practitioners, since the research shows promising results with high acceptability among parents, patients, and even the children. High retention rates with fewer complaints during the procedure. The main problem with us is the research is growing to a rocket pace, but unfortunately the practitioners are not up to date, not taking it, still following the same area that we need to remove the caries completely. So please get into this evidence-based, understand what is happening in the present world, and just go with it. That's why I always request, please follow the evidence and do the procedures. You are not doing it wrong. You are doing the evidence-based. You know that most of the practitioners, I don't know, I'm totally now with Dr. Muthu sir. I've been always talking, he is totally into early childhood caries. I was reading the Bangkok Declaration, which was given. How many of the practitioners who are not updated know that we need to use 1000 ppm of fluoride toothpaste, even for the first tooth, a child with one tooth erupted? I don't think so. 90% of the practitioners who say, even now they say that no, we should not give 1000 ppm. We have to give 500 ppm of toothpaste, ppm of fluoride in toothpaste. Why I'm telling this example? Because being the practitioners, you need to be updated with the research right now. Okay, so this is the area, and thank you so much for giving me this opportunity. Again, I have to thank you, the online dentistry, Dr. Joby sir, Dr. Binu sir, and I'm very thankful to you people. And next, it would be like incomplete if I don't mention Dr. Muthu sir and Dr. Shivkumar sir, who are trusted me and gave me the opportunity to write this chapter. And it's a good coincidence that online dentistry asked for webinar, and it worked out. And again, it will be incomplete if I don't thank my family, my friends, my colleagues. I think everyone are listening to me. Okay, now I hope I'll get the feedback regarding this, good or bad. I really expect a critic way to talk about like what mistakes I have spoken, and all the faculty who are seeing, all my teachers, please. Okay, so any doubts? And I'm very sorry for taking more time of sharing the videos and everything. So kindly, if you have any doubts, if you give me chance, I'll answer the doubts, Dr. Joby sir.
Thank you, Dr. Sunil. Thank you
Yeah,
so
thank
much,
you,
Doctor. That was perfect. We got more than 800 views altogether. That was a
okay,
big
that's so
number,
nice.
Dr. Sunil. Big number.
Yeah, that's nice to hear.
Again, so
Thank you
can
so
we
much.
quickly go through some questions, Dr. Sunil?
Yes, please. Yes, please.
Can we, sir, can we use this technique in anterior teeth in a child? Santoshi, Santoshi.
Anterior teeth, as you all know, that the stainless steel crowns cannot be given in the anterior teeth. The only area, the crowns what we give in the anterior teeth will be zirconia crowns. Unfortunately, zirconia are not so flexible that you can just slip the crown onto the tooth surface. So it is always in the posterior teeth, and I think definitely I cannot agree with doing this in the anterior teeth.
Could you please explain about the size selection of crowns, Dr. Shamna Jazim in Zoom?
Okay, okay, this is a nice question. Actually, the size selection, basically it looks like your footwear. How do you select your footwear? Select the size number 9. If it's big, go for number 8. If it's small, go for 8.5 or something like that. So your target in using the Hall's technique is that it should cover both mesial and distal surfaces. And when you are pressing it, it should spring back. Means it should try to go a little, because of the anatomy of the deciduous teeth, because of the prominent cervical ridge. It will go inside. You will understand when you're doing with your experience. You will understand that if I push more, it will go and settle inside. So that is the area. That is how you need to select the crown. Yes, I hope you understood. Thank you. Yes, sir. Any other questions? Hello, can you hear me?
Yes, yes.
Yeah.
You're
Yes,
audible.
yes.
How do you adjust cervico-occlusal height of the crown with respect to tooth? Also, please explain about lack of crimping and contouring leading to open margins proximally.
Yeah, basically the cervico-occlusal height, 99% till now, whatever cases I have used, because of the biocompatibility of the stainless steel crowns, it will slowly settle inside, and still the research is going on, but still no complaint from the parents as such or the patients as such that it is causing a discomfort to the child after a week or so. After a week, I can actually say with my experience, the literature says that it's a week or 3 to 4 days. I can say within half an hour, 45 minutes, the child will be very much comfortable. So regarding cervico-occlusal, I don't think so it would be a problem.
Dr. Binu, Dr. Sunil, can I take some questions from Zoom? I mean, YouTube. Many questions are from YouTube.
Yes, yes, yes.
So you have a big follower from YouTube. There are 380 people followed you.
Oh my God. Okay.
Sir, one is Dr. Tanusri Basu is asking. Dr. Tanusri is asking is, sir, is there is any clear contraindication of halt techniques?
Clear contraindication, as I told you, if a patient gives the signs of irreversible pulpitis, no chance that you can do Hall's technique, because you are literally packing the infection inside the crown. The patient will have pain. It's a total failure. That is an absolute contraindication of irreversible pulpitis.
Okay, sir. Thank you, sir. Another question from YouTube is Dr. Arthun M. Dr. Arthun M is asked one question is, RC treated teeth after crown placement are having problems due to marginal leakage and secondary caries. I mean, he is asking that after RCT treated case, whether we should give a full crown restoration like this stainless steel crown will be useful or not.
Of course, sir. Like usually we like particularly for the young permanent teeth where all the deciduous teeth have not exfoliated. In these teeth, when if the tooth is being RC treated, you can definitely go with this particular technique with the stainless steel crown. You'll definitely get a marginal seal rather than giving a conventional restorations where the failures could be more.
Okay, sir.
So yeah.
Yeah, one more question is Dr. Tejas Mutta is asking from our YouTube channel is, how much time should be the separators be placed in Hall techniques before placing the crown?
Okay, it maximum 3 to 7 days. Okay, 3 to 7 days. I have seen the cases like 3 days is enough, more than enough that you get space, because you need to just imagine the thickness of the stainless steel crown. It has to just fit inside. So it's very easy to do it within 3 days, maximum 3 days, 3 to 7 days.
There are many questions regarding about the concept of leaving the lesion untreated, like Dr. Arthum M. Shoheb Alam and many other asking one question, not understood the logic behind leaving the caries portion as much before placing the stainless steel crown in Hall's techniques. Is that their main query is that is it should we remove, I mean, leave the lesions untreated or should we do something like that?
We don't know, we don't do anything, sir. We don't remove the caries. The clinical signs and symptoms, the patient is not giving any pain or anything, and it's a multi-surface proximal caries. No need to remove the caries. That's what is the advantage for this technique, is that the glass ionomer being a fluoride releasing, it will definitely cause like arrest of the caries inside, and the microorganisms have no contact with the food outside, and no acid is produced, since as you know the caries triad. So there is a break in this caries triad, so it releases this yes, doctor.
Sir, one more question. One more question is, sir, we have to put separator in all cases, or separator itself creates spaces in 10 minutes.
Yeah, separators, it's not required in all the cases, as I spoke in the modifications also. As I spoke in the modifications also, the separators is not compulsory, because to be frank, my cases, like around 10 cases, if I have done 9 out of 10 cases, I have not given the separators. Separators is not compulsory. Separators is compulsory only if there are tight contacts. If there is a caries of the proximal surface, the break in the contact, no need of separator. Yes, sir. Dr. Joby, sir. Dr. Joby?
Yes, sir. There are some more questions on YouTube, sir.
Yes, please.
Sir, does it discolor the tooth because it's silver diamond?
You mean discolor because it's the silver diamond, we use it inside the tooth and above that the crown is placed. So there is no chance of seeing a discoloration of the tooth. That's one of the disadvantage for stainless steel about the aesthetics. Okay, but a discoloration of the tooth because of SDF is being covered by the stainless steel crown.
Sir, can we use Elliott separators for rapid space creation?
We can definitely use it's basically if the patient is convenient, if the patient is able to take this rapid separation, why not?
So one question is Abin Jose is that, sir, do you recommend the same technique for adult permanent molars? Dr. Binu, I think you are there in the Zoom. I think Dr. Sunil has lost his connection. Yeah, yes, sir. You are back, sir. You had a problem with the connection. Sunil, sir, you had a problem with the connection. Can you repeat that answer again? Are you listening to us? No, he has lost the connection. He has lost the connection. So, dear friends, let me conclude. Sir is very eager to come back because he has got some problem in the connection. If you have any queries, you are in our WhatsApp group, so don't worry. We will address all your doubts. You can put the doubts, we can forward to sir, and he can address all your doubts. Thank you so much once again for supporting online industry. Huge program, more than 800 plus candidates today attended. Thank you so much. So good night, stay home, stay safe. So we will be coming you with new programs on next week. Hectic November is being scheduled for free and paid programs. Follow us and be with us, and we will be delivering you new programs, clinically oriented programs. Thank you so much. Good night.